Good morning everyone. Today I will talk about how to insert a nasopharyngeal airways. Nasopharyngeal airways are flexible tubes with one end flap at the other end without that are inserted, without end first through the nares into the pharynx. Now I talk about the equipment for nasopharyngeal airway. First, gloves, mask and gown. Towel sheets, various sizes of nasopharyngeal airways, water-soluble lubricant, suctioning apparatus, nasogastric tube which is to relieve gastric insufflation as needed. Now, we talk about the positioning for nasopharyngeal airway. There are two positions in this topic. The sniffing position only in the absence for cervical spine injury. Position the patient supine on the stretcher. If cervical spine injury is a possibility, position the patient supine or at a slight incline on the stretcher. Avoid moving the neck and use only the jaw thruster maneuver or chin lift without head tilt to manually facilitate opening of the upper airway. Now, step-by-step description of nasopharyngeal airway procedure. As necessary, clear the oropharynx or obstructing secretion, vomitus, or foreigner material. Determine the appropriate size of the airway. When held against the side of the face, a correctly sized airway will extend from the tip of the nose to the tragus of the ear. Measure the length of the airway to ensure it does not cause obstruction. Open the nares to reveal the nasal passage. Inspect both nares to determine which side is wider. Lubricate the nasopharyngeal airway with water-soluble lubricant or anesthetic jelly such as lidocaine gel. Insert the airway posteriorly parallel to the floor of nasal cavity, with the bevel of the tip facing toward the nasal septum. For example, with the point end lateral and the end of the airway facing the septum. Using gently yet firm pressure to pass the airway through the nasal cavity under the inferior turbinate. If you encounter resistance, try rotating the airway slightly and read at once. If the tube still will not pass, try inserting into the other nostril. Advance the airway straight back until the flange is resting at nostril opening. That's all for my topic today. Thanks.
Insert the MPA with the bevel, which is on the end here. We're going to face that towards the patient's septum. So in this case, if we go into the right nostril, facing the bevel towards the septum, and we're essentially just going to push it vertically down into the patient's airway, allowing it to follow the anatomical curve of the airway